Hello, everyone, and welcome. Thank you for joining us today in our session on scaling behavioral science in the Global South, exploring innovations, challenges, and opportunities. For those of you who haven't come across me in previous webinars from the Behavioral Science Group, my name is Mary McLennan. I'm the Senior Advisor on Behavioral Science to the Executive Office of the Secretary General. I also lead an initiative called the UN Behavioural Science Group, which I will come to shortly. So I have a few slides about behavioral science across the UN, but before going into that, I just wanted to speak very briefly about why we're having this event today and perhaps some unique elements of it compared to other sessions that we run. So this event is part of the Summit of the Future Action Days taking place today and tomorrow and various other days in relation to the Summit of the Future, which is happening on Monday and Tuesday next week. So essentially the Summit of the Future is taking place in New York, and it brings together world leaders to forge a new international consensus, which is called the Pact for the Future. And we'll discuss various topics throughout the Summit of the Future Action Days, as well as the Summit of the Future, including sustainable development and debt financing, international peace and security, science, technology, innovation, and digital cooperation, which is where behavioral science fits into the themes. And then finally, youth and future generations. So if you're curious to hear about these themes and work and ideas that are being spread across the UN over the next few days, I encourage you to check out the websites that are placed in the chat and see the broader picture in terms of where our discussion sits regarding work in the UN. Okay, so before getting to our presentation, as promised, I'm going to give you a little brief background about behavioral science in the UN and the work that's ongoing. So I mentioned I lead the Behavioral Science Group, which is an initiative of the UN Innovation Network in the Secretary General's office. And essentially what we do is we bring together a number of colleagues, more than 6,000 members across 70 entities in 150 countries, who have varying degrees of experience with behavioral science. So they range from intro to more advanced. And essentially, just to share here, there's a lot of interest and demand when it comes to behavioral science across the UN at the more working level in terms of colleagues actually doing projects and interested in doing projects. And then going up to the more senior levels of the UN, just briefly here, you may have come across this UN 2.0 Quintet of Change. So these are 5 areas the Secretary General has deemed important for the UN to be nimble and effective and really have a forward-thinking culture and be fit for purpose for the 21st century. So they are data, digital transformation, innovation, foresight, along with behavioral science. So really amazing to see us elevated in this way at the more senior levels and discussions across the UN as well. So if you want to know more about behavioral science in the UN, I encourage you to check out a number of the publications that have been co-developed and created and authored with colleagues across the UN over the years. So there's the Secretary General's Guidance Note on Behavioral Science, the UN Behavioral Science Report, UN Behavioral Science Review, which features case studies, along with a guide we also created as well, tailored to the context of the UN. And those links are in the chat for you to check out if you would like to know more. And then if you'd like to keep engaged in our discussion, we encourage you to join the UN Behavioral Science Group. So although we have a lot of colleagues from the UN who are part of the group, anyone can join as an observer. So we have colleagues from academia, international organizations outside the UN, civil society, NGOs, the private sector. We're really trying to form a space for colleagues to interact and collaborate with each other through discussions as well as through sharing of knowledge overall. Okay, so that's the Behavioral Science Group. If you have any questions or comments there, feel free to include them in the chat, and we'll try to get back to you. But now into the session for today. So a quick note of housekeeping here. So essentially, we'll have opening remarks from we'll have opening remarks, and then we'll have a panel discussion, and then we'll have a Q&A session, a question and answer session. And in that part, we will include only the questions that are included in the Q&A box. So don't put your questions in the chat, only put your questions in the Q&A box. You can also upvote the questions of your colleagues there, depending on what you're interested in hearing about. So even if you don't have a question yourself, I encourage you to check out the box and see what the discussion is there. And then finally, after the discussion, the Q&A discussion, we'll hopefully have time for an interactive activity with all of you to hear your thoughts on scaling behavioral science in the Global South. But let's see how we go. Okay, so with that, on to our speakers. So today we have a number of really speakers with a lot of breadth and depth to their work when it comes to this topic of scaling behavioral science. So we'll first hear from Minister Esther Dweck, who's the Brazil Minister of Management, Innovation, and Public Services. And she's well known in the public policy space, both for her work within government as well as in academia, and really proponents of a lot of the issues related to behavioral science, and particularly some of the work currently ongoing in Brazil, which we'll hear from shortly. Then we'll hear from a panel of Desmond Duametu from the government of Ghana. He'll give us some really good and interesting case study examples of how Ghana has embedded behavioral science work into some of the projects and initiatives within the government. And then we'll hear from Catherine McLeod from Ideas 42, who'll speak to some of the partnerships and relationships that are needed in one activity that Ideas 42 did in really scaling behavioral science to multiple countries within the African region. And then we'll hear from Cash Ramley from UNICEF, who'll speak to some of the ways that UNICEF is working to embed behavioral science in governments, units, and teams around the world. We'll also hear from Khurshid Zafari from the government of Uzbekistan, who will speak to how the government is going from one project to 2 projects to more and scaling behavioral science in that way. And then finally, we'll hear from someone who's probably, again, well known to this community for her work in this space, Anisha Singh, who's currently a PhD candidate at the London School of Economics, was previously a vice president at the Busara Center. Okay, so with that, I'm going to turn it over to the remarks from the minister. Okay, going over now.
Everyone, I would like to thank Mary McLennan, Senior Advisor on Behavioral Science to the Executive Office of the UN Secretary General, for the invitation to participate in the side event to the Summit of the Future. It is a pleasure to join this important discussion on scaling behavioral science in the Global South. Behavior insights have the potential to greatly transform public policies, particularly when tailored to the unique and diverse context of our region. As has been highlighted by United Nations, behavioral science may play a fundamental role in advancing the Sustainable Development Goals by providing practical, evidence-based tools to address some of the greatest contemporary challenges. In a world marked by the climate emergency, rising inequalities, and challenges faced by public institutions and democracy, it is essential to develop public policies that promote more inclusive, cooperative, and sustainable behaviors. From the global north, it's crucial that we harness and expand evidence that resonates with the realities and challenges we face in the global south. By drawing from cases and innovation closer to our realities, we can craft solutions that are both effective and deeply relevant to our local context. In Brazil, the Ministry of Management and Innovation in Public Service is dedicated to improving state capacities and driving innovation in public administration. This focus on innovation is crucial for modernizing our public services, as well as ensuring that they meet the needs of all citizens, guided by right-based perspective. A key part of this effort has been creation of CINCO, the Behavioral Science Unit, an important innovation hub in the Secretary of Management and Innovation. This center leads the way in applying behavior insights to public policies. Through CINCO, we collaborate with various ministries and government sectors to address public challenges using behavioral science as a key tool in developing solutions. This collaborative approach has enabled us to address a range of issues, from promoting sustainable procurement practice and supporting agroecological transitions to improving social welfare programs. For example, our family care initiative focuses on providing better care for vulnerable children, while other projects aim to improve social security services for those in need. These efforts, guided by behavioral insights, are helping us to create a more effective, accessible, and citizen-centered public services. Addressing the challenges that are to the global south requires us to embrace innovations and context-specific approaches. The complexity of these issues demand solutions that are not only creative, but also deeply rooted in local realities. Behavioral science offers innovative tools to tackle these problems, particularly in advancing human rights, gender equality, and inclusive development. Let's use this opportunity to strengthen our collective efforts and ensure that in this behavioral science revolution, no region, no country, and no one is left behind. Thank you very much.
Great. Okay, well, thank you very much for those remarks from the minister. Really inspiring to hear how one government is truly taking behavioral science forward in a really meaningful way at various levels. Okay, so now on to our panel discussion. And just say, if you want to know more about behavioral science in Brazil, during the Q&A, we'll also have a colleague from CINCO, the team that the minister mentioned. So if you have some questions about Brazil and how they're working overall, feel free to put those in the chat. And we can also revisit that later in our Q&A session. Okay, so with that, on to our panel for today. So I'd like to ask Kate and Desmond to turn on their cameras if they can and join us for our first question here. So this is around, Desmond, are you with us?
I'm struggling to get the
Oh, that's
camera
all
on, but
right.
I'm
Don't
here.
worry.
Yeah,
We can
yeah.
hear you. We can hear you
Okay, that's
clearly.
good.
That's fine.
Yeah,
We'll
sure.
just proceed like this then. So yeah, so the topic of today's session is scaling behavioral science in the Global South. And I know both of you have worked on a really interesting example of this, as I alluded to earlier. Do you want to maybe start with a few remarks upon what you've done in this area and what you may be able to add to our discussion today? Maybe Kate, over to you first.
Yeah, definitely. I'll share a few slides to share a bit about this. It's great to be here. As Mary mentioned with my colleague Desmond, I'm going to be talking about a partnership between Ideas 42, the World Bank, and country governments to incorporate behavioral science into cash transfers. So far, we've worked with 11 country governments to design behavioral interventions for cash transfer programs, and run 7 randomized controlled trials that showed that these designs have positive impacts and are cost effective. I'll drop our evidence hub into the chat so that you can see more detail, but today I'll really highlight the collaboration. This has been a partnership between country government partners who provide contextual expertise, co-design interventions, and make decisions about and own the scaling process. The World Bank, who facilitates collaboration and has been advising on the overall strategy, and Ideas 42, who acts as the technical behavioral science experts. I wanted to start by reflecting about a few learnings from the work. First, given that governments, especially in low and middle income countries, have limited resources, we've found that it's really crucial to design for scale from the start to scale behavioral science or behavioral interventions to ensure easy integration into existing programs, and to calculate cost effectiveness as one tool to guide scaling decisions when the governments are making those decisions. Second, we've found that building a community of practice has been really vital. Community of practice events have enabled cross-country sharing of challenges and solutions around scaling, while also generating new ideas around how to apply behavioral science to social protection programs. And finally, an exciting aspect of this work has also been south to north learning in this area, as cash transfers are much more common in the Global South, and while pilots are growing in the Global North, they often struggle to move to policy. During COVID-19, we shared insights from this work to inform emergency cash transfers globally, and we're continuing to explore how this work can support the transition of other programs from pilot to policy. With that short intro, I'll hand it to my colleague Desmond to share more about our experience and about the path to scale in Ghana.
Thank you very much, Kate, for setting the tone for the discussion. Well, my name is Desmond. I work on an economic inclusion program that literally looks at how we can move persons from cash transfer programs into the economic inclusion space. So we have been implementing this for well over 7 to 8 years, and our relationship with Ideas 42 started in 2021, that is post-COVID, when we had to work on some beneficiaries. And literally what we did was that we, together with Ideas 42, came out with a design that could help beneficiaries improve upon savings as they engage in a productive or economic inclusion activities, and also help them grow their investments. So we carried out an initial pilot that was under the guidance of Ideas 42, and the outcome was quite positive for beneficiary behavior in the area of savings. So subsequent to that, after we have disseminated the results and outcomes, we decided to scale up as a country, as a government, and we have scaled up the program since then, moving from a pilot on about a little close to 4,000 beneficiaries to 14,000 beneficiaries. Now we are expanding and we are growing the program. And literally what we are doing is that we are helping beneficiaries that are on the economic inclusion program to, inculcating them the habit of saving that would translate into improving upon the program outcomes. Well, it has been quite exciting and revealing in a sense that from the work we did with Ideas 42 and moving into the scale, we have taken note of a few things and how this thing has impacted on beneficiaries. And I would like to touch on an important aspect of it where we join with ideas for the two came up with the design. I think that was instructive in getting it right and tailoring the design to meet the objectives of the program. Well, we have seen some results in this area where beneficiaries have picked these lessons, and it is exciting to know that 3 years into post the intervention, beneficiaries have still keeping their boxes and are saving. Basically, what we do is that once we give them the startup grants for their investment, we encourage them to put some of the earnings from their investments into their saving boxes, and they have set goals. Some have decided to plow back some of these earnings into their investments, by so doing growing the investments. Others have also decided to pursue life goals, such as some want to acquire motorbikes. And it is interesting that some of the feedback we get, for instance, this lady we saw, she told us a story of how hitherto she was just keeping every money in the house and they were spending it anyhow. But once we came out with the behavioral nudges on goal setting and savings, she had moved away from that and now putting her money into the saving box, which is helping her to achieve some goals that go to affect the households generally. We also have an exciting story of a beneficiary pilot. He picked the lessons and went ahead to, as it were, come up with her own box. And today that beneficiary has acquired motorbikes and is engaged in petty trading. So we have a plethora of such exciting stories that beneficiaries are telling us. And as a result of this, we have decided to scale the program up, and we are covering 14,000 beneficiaries now. An exciting part of this also is that as a government, we have fully embraced it, and we have integrated it into our regular government program, such that it does not become another layer of cost. And that is how we are able to get policy buy-in for this. So it's an important lesson that we'd want to put out there, that often when you come out with some of these interventions and you make it look like a standalone or another layer, then you are met with pushback. But we work well with Ideas for the Two to integrate it into our regular programming seamlessly, so that it does not become another layer of cost. We have also looked at how to do this cost effectively or cost efficiently, and that has helped to, as it were, allow our decision makers to embrace it. As I speak to you now, there is ongoing work to scale this to the regular cash transfer program, and also to the public works program that we are pursuing within the social protection space in Ghana. And so these are the lessons for us. And one other thing that I'd like to touch on is how this is leading to developing institutional capacity, so that as a country, we fully own it and embrace it. In our approach, we use the district assembly or local government staff to be the facilitators. That has done two things for us. It has, first of all, managed the cost for us, and it has also helped us to retain some capacity, so that these new ideas that I've learned are extended to other government programs that is helping to yield results. Well, for us, for this to be accepted, we need to manage the issue of cost and also have evidence to prove that it works. These are the little things I'd like to share for now. And along the line, if anything comes up, we can dwell some more on it. Thank you very much from my side of the story. Thank you.
Great. Thank you so much, Desmond and Kate, for your reflections on this example. I think you could have had a whole webinar, just this one project, but really interesting points about how to bring the community together, how to share lessons across different countries. And Desmond, really impressive numbers in terms of going from that 4,000 to 14,000 and more, all within the work that you do. So maybe just picking up on kind of a point that both of you had mentioned a little bit about how to learn to build buy-in in governments for scaling behavioral science. So there's lots of examples I think we can point to of colleagues who've done pilots in behavioral science. And then the next question is, how do we do that? How do we keep a relationship going? How do we do what Desmond alluded to, had mentioned from the work they've done in Ghana, from building into capacity into the programs themselves? So what lessons did you learn in building this buy-in? And then how can partners better to collaborate with governments in the Global South? What any tips or advice might you have for others thinking about doing something similar? So yeah, over to you.
Yeah.
Desmond, would you like to go first?
Okay, so you want to take that, or I should take it from my side? Yeah. Okay, so yes, I think it is important. I mean, for me, it's one of knowledge transfer that is coming from an institution that came out with this, and also letting government fully embrace and own it. And as I indicated on our side, Well, there was a little bit of pushback or foot dragging initially, because then there was no evidence that this was going to add value to what we're doing. But once we had evidence and we went on a national dissemination where we showed the results, I mean, it is making it easy for people to embrace it now. And we are also trying to look at it and customize it. So that I think it's an important element here. Once you customize it and you make it address the needs of the program, I mean, that partnership obviously be there. Even though we have ended formally our relationship with Ideas 42, the fact that I'm here with Kate alone will tell you that we still maintain that relationship because, well, we have just gone through one pilot and we are scaling. Still, because the program is one that is run by the World Bank is playing that facilitating role of getting that relationship fostered so that we would still get technical support from Ideas 42. It will take a while for us to say that we are fully, owned, we fully know it and are able to apply it. So we keep on maintaining that relationship with Ideas 42. And one of the issues, like I touched on, was the fact that, look, you might make this look like one that can be managed. The cost must be managed. And we all know in our part of the world, procurement and people are mindful of cost. So once you make it sound that yes, it's one that can be managed within cost, I mean, obviously governments would embrace it. Everybody is looking at how we can improve upon our lot. And often when these things come from external institutions, we want to say, okay, a lot of the money is going to go into it. But when we own it and we introduce our own ideas into it and we let it reflect the needs of the program, that partnership obviously will be fostered and will be sustained.
Yeah, absolutely. Just to add on some of what Desmond has already mentioned, we've been working with a number of governments, and many of the government partners we've worked with when we started to engage hadn't been engaged in behavioral science projects previously. So one of the things we found most crucial was to ensure that key partners and champions were really engaged throughout the process so that they could then advocate for and really own the designs at scale. One of the things we found was that our government partners were often aware that the behavioral problems we were trying to solve for already existed, but really taking that behavioral lens and going through the behavioral design process, I think sometimes provided kind of new tools to try to solve those problems in a different way. So one of the things we've really found across many of the partners that we've worked with is including our partners in the diagnostic research process and co-design and seeing how program participants use the design and test results, as Desmond had mentioned, I think has often led to identifying key champions in the government that really become the advocates for scaling and driving this forward.
Just one more thing to add. I mean, you'd have to make it look very simple. You don't make it look that sophisticated, and that's what we were able to achieve with Ideas 42. I mean, just soft touches and the impact is out there great. But if you make it very sophisticated, then you would definitely let people move away from it because then it is looking like something that cannot be achieved. But like I said, we looked at our local context and contextualized it such that it gained acceptance, and we are happy to let you know that 3-4 years down the line, you still have facilitators in the communities that are using the new knowledge acquired.
That's so great to hear, Desmond. I mean, amazing to see lots of little tips in there for colleagues thinking about this, how to do this, tailor it to the context, tailor it to the country, make it like perhaps simple, just additional add-ons to what work is already ongoing, evidence, show the results and what works in a way that's meaningful and what resonates with the government and the partners on the ground. These are all really helpful things. And we're curious to unpack that some more with you. Maybe we can go further in the Q&A, what that means to show evidence, what that means to really customize in specific ways you've done that. But so we park this here for now. We can come back to this later. Thank you so much, Desmond and Catherine for joining us, or Kate for joining us. And yeah, we're going to go on to our next series of panelists for today. So over to Khurshid and Kash Ramley from UNICEF and Khurshid. Great. Hi, Kash. Thanks for joining. And Khurshid. So great. Thanks for being with us. So similar question to you to kick it off. I mentioned a little bit about what you're doing together and the work overall, but what are you doing together? And how are you scaling behavioral science in Uzbekistan? Turn it over to you.
So, I mean, I'll start with the more UNICEF global perspective, and then I'll pass it on to Khurshid to talk about some specific applications within the government of Uzbekistan. So for UNICEF, at the core of our work is about partnering with governments. Everything that we do involves partnering and signing off with government, working together to implement these things. So it was only natural for us in thinking about how to grow behavioral science to move towards thinking about how we can build behavioral science within governments. This allows us to, this has multiple benefits. One, it transfers ownership to various local governments, but then it also helps to get better buy-in for when you do need to scale. So even though we can run pilots, if we haven't got the government bought in from the beginning, then it's very difficult to then scale any single pilot. So that close partnership is critical, and the best way to form that partnership is by developing a behavioral insights unit for that. So we're doing this across the world, either through, and it's not always through government. Sometimes it's through universities as well, building various behavioral science labs, for example, in Ethiopia and in Malaysia, we have a few. But Uzbekistan was a great example because this wasn't one where we were engaging with the government, but rather the government came to us. Khurshid came to us and wanted to build a behavioral science unit themselves because they saw the potential. And so it was a very exciting project for us, but I'll pass it on to Khurshid now to talk about his vision about growing behavioral science in Uzbekistan. Thank you.
Yeah, thank you, Kash, for inviting me to this panel discussion. First, and nice to meet you all. And unfortunately, I cannot share examples like Desmond did because we are just starting our initiatives, our structure on behavioral insight unit. And the rationale behind creating such unit was that last year the National Agency for Social Protection was created, and with the aim of improving social protection services and assistance to population. And when we tried to reach out to those people who are in need, and we developed better methodologies of how to reach them. But in Uzbekistan, like in many other developing countries, we have a big share of informality that makes any targeting formula almost useless if you want to reach out to the people who are in very vulnerable situation, because they don't have any registration, they don't have any records, online records, therefore. And if we want to improve the coverage, we should have come up with other solutions. And then we thought about integrating behavioral insights in reaching out to those people. If I can say in other words, how we can decrease exclusion error via behavioral insights. So the first point of entry for behavioral insight in Uzbekistan, we think that identification of people who are socially vulnerable. And then in later stages, we will then use this approach on improving the quality of our services. So now we are working with Kash on improving our methodology of identification low-income families who are eligible for cash transfers. Then we are also thinking about improving like a saving behavior of people who are in less favorable conditions. So we have a lot of ideas, and we want to set an example for other government ministries as well on introducing behavioral insights in their policies.
Great, thanks for that, Kash and Khurshid. Nice examples of how UNICEF's working to do this, and then also what's going on in the government in Uzbekistan, and how you're actually practically thinking about this. So reflecting, zooming out a bit, maybe to people listening into this call and our conversation, for colleagues who are perhaps thinking about starting behavioral science units and member states and governments and the global south in particular, and scaling that to the extent that you have, at least the early stages. How does the UN do this, Cash? But then also maybe from how did you outlined a little bit like how you're working with Cash, Khurshid, but what role could the UN play in doing more of this with governments and member states? Maybe some reflections on how the UN can be helpful and useful. I know Cash, you mentioned a bit, but any broad reflections there?
Yeah. So going back to the concept of partnerships, one of the things that the UN can do is facilitating partnerships between governments and other institutions or even other governments. I think with the cash transfer program that I referred to and the Ghanaian government talked about was great because we're talking about a similar form of intervention being scaled across multiple countries. I think greater collaboration between those countries. And so having more behavioral science units in different countries and the UN facilitating those partnerships is a great point. The other one on a more practical point, and this is why it's been so great working with Khurshid and his team, is not necessarily just parachuting in, doing training, and then disappearing, which I think is sometimes the easier thing to do, but it involves a lot more investment and deep integration and working together over a long period of time. I think it's not that we're transferring any capacity or anything. Like Khurshid and team and his entire team are absolutely brilliant, and they don't necessarily need me at all. But it's how we facilitate. They don't need me in terms of behavioral science, like they are fully capable of doing that. But it's more about helping them through the process, helping them connect, helping them think about the other components that are less interesting or technical. Yeah.
Yeah, Khurshid, please come in.
Thank you, Kash, for kind words, but we need also capacity building, frankly saying, because in Uzbekistan, we don't have university degrees on behavioral science. In Uzbekistan, universities do not teach behavioral science. Therefore, it's the resources are very scarce. Therefore, the work that is being done by UNICEF on supporting building our capacity, like nation capacity on behavioral economics, is really crucial. And from the institutional point of view, we do not want to how to say monopolize behavioral economics, if I can say so. We are also trying to build capacity of wider community of behavioral economists in Uzbekistan to create some kind of movement of behavioral science, make it more popular in Uzbekistan, so that it is then is taught in universities. So from this point of view, I think the UN is really crucial in bringing different expertise where we can tap on and build our own evidence. Thank you.
Great. It sounds like a great partnership you built there, and lots of that other colleagues can learn from as well in terms of working together and building on connections and expertise and learning from each other as well, which is great. Okay, thanks, Cash and Khurshid. We'll come back to some of the questions. I see some are relevant to this, so we can revisit them in the Q&A later. Thank you. And next we'll move on to Anisha to share some of her thoughts with respect to scaling behavioral science in the Global South. So given your breadth of experience, you've worked for a number of years across a number of projects in this area. What are some general reflections that you have in this space, and what might you add to our discussion today?
Yeah, I think some fantastic points have been made all around on sort of helping partners, universities, institutions, government bodies to reach their respective goals, whether you are the IDEAS 42 or you are the government. I think integration into ongoing and regular programming in a cost-effective manner seems to be a big learning as well. And then this notion of like, what are the quick wins that you can use to generate evidence and transfer ownership for scale. So definitely agree with all of those. I'll try to add some broader lessons, maybe one or two from the challenges that I've seen working a lot in Sub-Saharan Africa and India that we grappled with and sort of learned from. So from working on these collaborations across the regions and talking to many experts in the field, I think there seem to be like 2 points of alignment that are needed with partners and communities, no matter who which part of the partnership you are in. And one is sort of aligning with partners on the foundational definitions for some of the words we just used in the webinar itself, right? So how do different partners understand evaluation? How do they understand behavioral science? There are questions on like which part is human-centered design, which part is behavioral science? Does it matter at the end of the day? How do you think of testing? Do you think of it in the same way? Are you thinking of an RCT and your partner is thinking that a survey assessment is enough? Those sort of like definitional differences we've seen create sort of dissonance down the line and are important to iron out early on during the sort of expectation setting process. But I think more importantly for me, there's a tension between this idea of libertarian paternalism that we use a lot when we explain the ethics of behavioral science, and how we usually go about defending the ethics is to say that we're really like filling an action and intention gap, right? Like people have this intention and they're just not taking action for whatever those behavioral reasons are, and that's the gap in which we operate. However, from what I've seen and from speaking to colleagues in the field across the years, it's more than that. A lot of the times you're trying to create intention and demand in the first place. You get put up against norms, that social norms or cultural norms that are deeply entrenched. And you're not simply, it's not behavioral science in the global South is not always just about, bridging that action intention gap. And some of these questions that we work on and tackle as practitioners are not sort of neutral, right? Like there are culture or value-laden questions that come into being. And often what you believe is good is not shared by the community or by your partner, or it is shared by a partner and something else is deemed useful by the community, and sort of navigating that space respectfully has been key, and I think is one thing to keep in mind. I can give an example of it quickly, which was, and I have my example, I think, is still more neutral, was we were trying to work on increasing adoption of HPV vaccinations in India and Kenya. And just speaking to the various stakeholders involved, whether it's doctors, pharmacists, women, parents, young adolescents, there were a variety of different perspectives. So the doctors felt that, oh, these immunizations are not part of our current immunization package, we should just leave them out. You speak to the men and the men say, oh, our partners should be faithful to us, so there's no problem of getting STIs, so we don't need a cervical cancer vaccination. You speak to parents sort of thought, oh, maybe the HPV vaccine is a way of, is a family planning tool in disguise and promotes infertility, so no. So, when you're then trying to work on a vaccination that is for cervical cancer, you're tackling a very different landscape, and you're trying to see what the appetite is in a very different way. And of course, I've heard so many stories when you expand these to more trickier topics, which would be tricky anywhere, sort of family planning, sexual and reproductive health, intimate partner violence. That space just gets even more murky on how do you find what values prevail, how do you align values, how do you be respectful of different values and different approaches. So I think just being mindful that sort of behavioral science isn't neutral as it is, but it definitely isn't neutral when it comes to the global South. And that sort of really stuck with me in how you navigate partnerships. The second thing in terms of learnings that I'll talk about quickly is sort of this idea of scaling to and scaling up. I think maybe in the summary we did mention just today on it's important to tailor interventions to the local context. And I think about 90% of everyone's work is tailoring for local contexts. But it does, to me and to a lot of us, bring up this question of then what is scaling up from local contexts look like, right? Like we all take this approach of, we know loss aversion or growth mindsets matter. How can we tailor it? We're seeing a similar problem. How can we use those ideas and design an intervention? And then we take the context into account at the intervention stage. What I think in the future way of scaling up behavioral science in the global South is to sort of figure out what are we not seeing? What are the biases, the mechanisms, the behavioral principles that we're overlooking? Because we're starting with these ideas that have been studied in Western literature to a greater extent. So if we were to look beyond the spotlight within the global South, what are sort of mechanisms that are uniquely Kenyan, uniquely Ghanaian, that we might not even think of when we're looking at this? And I can give some examples of work maybe just I can give more in the Q&A, and I can just wrap up with a quick one now. I had some colleagues at BeSci who were working on the foundations of moral foundation theory, and there are sort of these 5 domains: harm, care, and so on. And then they ran this work across different countries, Uganda, Kenya, Tanzania, and found that there are unique foundations for moral theory that come up, which are like community. And then how do you factor that in? Because it's not part of the theory if we just apply and contextualize the theory. So how do we create that space to really see what is the ground reality and build from there rather than building to there? So yeah, I can maybe stop with that for now. Yeah.
Great, thank you, Nisha. Lots of really, really insightful points about how we can really reflect upon the global South context and what we're doing in the work overall. So yeah, we can pick up some of these in the Q&A. How about we do that, given we have a lot of questions coming through, and we all have a lot of time left. But thank you so much. Oh wait, so maybe I have one more question for you actually before we go.
Sure.
Yeah, I think it's important. You mentioned partnerships in particular is the theme that's been going across the sessions for today. So what might you say about this topic in terms of colleagues listening and areas they can perhaps explore with respect to scaling in particular when it comes to behavioral science? Maybe let's do that before we go to the Q&A.
I think maybe one thing that's come up in little bits, but maybe to call it out, because I think it is very important, is we're talking a lot about partnerships between different types of institutions, between governments and behavioral science bodies, or between UNICEF and governments, or between universities and UNICEF. I think there's a lot of untapped space for partnerships between behavioral organizations themselves, or units across governments. So not to put anybody on the spot, but like the behavioral unit in the Uzbekistan government within the Ghanaian government. I think there's a lot of space there. And I remember when I was with BeSci, we collaborated with Nudge Lebanon. So we were headquartered in Kenya, and they're headquartered in Lebanon. And that really, you build on each other's niche, you expand geographical reach that way. You think about approaches to policy, to questions, to solutions in a different way. And I think maybe as a low-hanging fruit, in my opinion, you mentioned a behavioral science group as we started this webinar. Like, that's something I think that could really push the boundaries on cross-learning and facilitation across the behavioral science units themselves.
Great, thank you for that. That's definitely something we can unpack too in this Q&A. How do we actually keep this conversation going and share more going forward in the future as well? So thank you for that, Anisha. So now we're going to cover a few questions if we can before we get to the end of today's session. So can all panelists please turn their cameras on? I think we're also joined by our colleague from Brazil, Antonio Clara Campos Filho, who's with us. If he's here, he can turn his camera on as well. And yeah, so we're going to ask a few questions. I'll try to group them because we don't have a lot of time. But the first sort of theme of questions that have arisen is around basically buy-in when basically working with governments, and how do we create units or sort of more systematic groups applying behavioral science. So there's one, I'll just group some of them. So feel free to respond to whichever question you'd like. I'm going to turn it over to you all in a second. There's one around how do you build buy-in in government partners? So sometimes it's the questions around, it's easy to, you don't really know the activity you're doing. You don't have a specific example in mind. How do you kind of get going? If I'm understanding this question correctly, how do you get going without a specific point of entry maybe? So that's one in terms of working with governments in particular. There's also a question around how do you do this without governments? How do you do this? I know Anisha mentioned some other organizations. There's Ideas 42. There are other partners. How do we do this if it's not with the government? Are there ways of working? Cash mentioned academic institutions, maybe expanding upon the other partners too, to do this overall. And then questions around how long does it take to form a behavioral science unit? Is the unit big? Any describing key roles, but how you would practically do this? I know it's a lot, but any kind of specific starting points, maybe just the extent to which work is involved in doing this in countries, maybe as a comment there. So I'll leave those questions over to you. Any comments or reflections on those based on the discussion that we've had? Please feel free just to unmute yourself and come in.
I can quickly, just on the point of like how long it takes, I think that's basically very much related to the buy-in question, because the more bought in you are, the quicker it will take. Because like many projects that we have, the bottlenecks are usually administrative limitations that kind of slow things down. So if you have an issue or agenda that's widely bought in by the government, I feel like typically that will expedite things, because also lots more money gets involved, and so easier.
Hi, everyone. I'm Antônio Clare from Brazil. Sorry, but I'm not being allowed to open my camera. I don't know if the host can open my camera, please.
I can do that for you, yeah.
Thank you so much, Mary. It's a pleasure to be here with you. And taking this question of how long does it take, I can talk a little bit about Brazilian experience. We now have a unit that is completing 1 year of existence. But before that, we have a lot of initiatives, local initiatives in the local governance, for instance, in the municipalities, in the academia too. And also we have an effort to gain more critical mass in the National School of Public Administration. We have during maybe 6 to 7 years, a lot of courses of behavioral sciences applied to governments, and also innovation projects in our innovation lab. So we have some events here during these years. We have the opportunity to have, for instance, Ideas 42 with us in one of our meetings, and also people from World Bank and Behavioral Insights team. And then with the articulation with UN and also OECD, we have this opportunity to show how behavioral science have been applied in the global context. And then we begin to gain buy-in from the new government when Lula came to presidency again in 2023. And then we have the opportunity to build our unit in the Ministry of Management and Innovation, as the minister said before. And then now we have 15 people working with us from different profiles, from professors at the university to people that works with design and public policies in general. And I think it's each case is a case. But in Brazil, I think we have built our path from the experiences that came in an experimental way, and then now we are getting a more scale and more system track when we were created as a unit inside a transversal ministry as the Ministry of Management and Innovation that has a mandate to support different areas in federal government, but also to support local governments. So not to speak too much, this is my first answer to this question. Thank you so much, and it's a pleasure to be here.
Great, thank you for joining us. You can turn your camera on now. I think you should be, oh, there we go. You should be able to. Thank you for your comments on reflections in Brazil. So yes, thank you. Anisha has put some links in the chat to say as well, there are some links from Ideas 42 that Kate shared as well. So yeah, feel free to check those out. But any other comments or questions on this from the panelists?
One from our end, I think in our experience, speaking about building buy-in and building those relationships with governments, I think a lot of that from our experience has really been about building the relationships and figuring out where we can be most helpful. Often with the governments that we work with, even if there are folks who have experience or are interested in behavioral science, there's not a formal behavioral science unit. It's not something they can be focusing most of their energy on. And so coming in, building those relationships, brainstorming with them on how we can be most helpful. And I think flexibility in that also really helped us to identify where we can really plug in and build those relationships. And one example, so we've been working on this kind of work for about 10 years now. And so we were in the process of building some new partnerships in late 2019, early 2020, to start a series of new projects when, of course, COVID happened and many governments, particularly cash transfer programs, really shifted towards focusing on just making sure we're getting cash into the hands of people who need it. And so one thing that quite a few governments that we worked with requested our help with during that period was, how can we adjust our communications to be behaviorally informed so that we can give clear and easy information to people about how they can receive their cash safely during this time. And so we shifted a lot of our engagement away towards that and really focused on that for a few months or so. And I think that helped us to continue to build that relationship to learn more about the programs and to figure out how we could best support going forward.
I can quickly speak to one of the questions there is a question on what's your process to learn about local customs and values. I'm sure everyone has good responses to this. And I think it's like uniquely important. I think one that's really obvious but sort of gets overlooked is going beyond the people who you think typically as partners, right? So involving whether it's a sociologist, a local anthropologist, a community leader, a sort of network influencer. Somebody mentioned the district, they work with the district commission, but involving those people in the research processes itself. So from the beginning and through your identification of what the problem is towards developing and sort of testing out a solution as well as scaling it up. So I think there are a lot of these community nodes that we overlook and local researchers that we overlook that can really sort of guide the entire, like we're all just bringing a small piece of the puzzle, right? There are other parts that need to be filled.
Great, thank you for that, Anisha. I don't know if Kirsty, you want to comment, or the next thing I was going to ask, the next question I was going to go to is how do we take into account local customs? There's also a question on how does this relate to human-centered design? There's also a question related to how do we empower the people we work with in terms of what we do? So maybe it doesn't need to be a full, if some of the panelists want to comment on those kind of the breadth of maybe the process of how we do this, maybe perhaps how it's a little bit different from other ways of working. I know Anisha, you talked about it a little bit. You can expand on what you were saying, or Kate or Cash, or others like to, yes, please, or Cash, please come in and then others can respond to you.
Anyone else, please? Okay. I guess mine is more of a tricky thing that I'm on this topic. It's something that I'm kind of battling with, which maybe some of you have insights about the taking consideration of local culture. And Anisha, you touched on this in your presentation, which is that okay, so at the moment we take these standard interventions and then we try to localize them in the context. However, maybe we need to take a more bottom-up approach where we first look at culture and then develop interventions. And I think one of the things that we're struggling here when thinking about scaling is how can we do that at scale, right? Because what we experience is that every time we do this, we're investing heavily into the start of the project, trying to do that investigation, trying to understand all of that. And then you get to a pilot phase and maybe the effects aren't that big or something or another, or even if it is effective, it's useful within that specific context. But then to scale that becomes extremely tricky and expensive and operationally challenging, and lots of other things. Where you have a contrast where, say, for Ideas 42, and where you have a standard cash transfer program, and obviously there's a lot more to it because it is localized and everything, where it is sort of an intervention that we know kind of works. We still have to localize it, but it makes it much easier to scale across multiple countries. And that's genuinely something that I don't know the answer to, but I would love to hear everyone's thoughts.
Yeah, please come in.
Well,
Kate. Oh, yeah, Claire, please come in.
I just like to add in this how we are engaging with our colleagues to work with behavioral sciences. We are trying to work with a co-production of solutions, of understanding of the problem, and also the co-production of solutions. So we don't see ourselves as a separated units that brings problems to us, then we process the problem and give solutions. We work with them since the first phase, since understanding of what's the behavioral problem inside a huge policy problem, a larger policy issue, and then to understand the problem and to develop solutions, test solutions, but also from the beginning with the teams from for instance, the social protection ministry, the team from the small enterprises team. So we're trying to create capacities with the partners, so they may change their mindset and try to begin to think from the behavioral lenses in their daily jobs. So this is a way that we're trying to work, not as a separated unit, but as a promoter of building capacities with these teams that engages with us in this project. So we are launching calls for projects, and then we have the several areas of the administration, the federal, and even also the local administrations, subnational governments, and then we process with them what we call journeys. Journeys, first to understand if there is a behavioral issue there. And then the other phases that you know quite well, we generally go to the five phases of understanding the problem and getting deeper to this, to them bringing solutions, testing, and scaling. So that's the way we are trying to give scale to what we are doing too. Because obviously, even with our teams not small, 15 people, it's much smaller than it would be to cope with all the demand that we see, that we have, that we receive from the distinct areas of governance. So that's the way that we are trying to gain scale and also involve people in our work.
Excellent point there, Claudia, about how we how to actually keep this going with a small, even if 15 people, it's not a small team, as you said, but it's still never enough, right? So, okay, so we're reaching the end. We have, if you can stay a couple more minutes to our panelists, if you want to add any other comments, I think we've kind of got some more of the debate, the behavioral science debate happening now. I don't know, Kate or Nisha or Khurshid, if you had any thoughts on these topics.
One point,
yeah, please.
I also looked through some questions in the Q&A box, and I want to respond to one thing that we are also trying to use behavioral information not only for our beneficiaries but also within the system. How well we can integrate behavioral insights to improve the quality of our services. For example, we can use it for improving the service quality of social workers. We can also use in developing KPIs, and therefore we are looking into the experience of other countries. And here I think it's very important the methodology of generalizing the generated knowledge to other developing countries, because as Kash said, it's very expensive to do some interventions from scratch. Therefore, if we can also develop some methodologies on generalizing, that will be also helpful. And in this sense, I also see that UN can be helpful from this perspective. And answering to the question on how long does it take to shape a behavioral insight unit, for us it took a pretty long time, because not because of the buy-in or the government was not interested. It's simply because we had to find the right people who can do it, and that in developing countries that can be also one of the limitations in creating behavioral insight units. Thank you.
Thanks for that, Khurshid. Really insightful comments there. Desmond, did you want to come in?
Yes,
yes,
yeah.
please.
Just to add a few thoughts to what has been discussed. I think on the whole question of scaling, I think from our experience, you don't want to scale just for the sake of scaling. For us, we have been mindful in ensuring that there's capacity enough to support that workload or caseload, because what we have tried to do is to develop capacity and also to develop local champions that can own the process, so that you don't just scale where it will affect the fidelity of the program. You want to maintain the fidelity of the program. So this whole question of scaling must be looked at within the wider context of what added value behavioral science can bring to the program. Ours is a cash transfer program. We have tried to to cascade the implementation processes. We've developed capacity at the local government level to own it, so that we can retain some there. But you also don't want to scale to a point where you would lose you lose touch with what is happening on, so that it goes to affect the fidelity of the program and give behavioral science interventions a bad name. So it's something that we must keep an eye on as we discuss this whole question of scaling. So in our experience, for instance, we have tried to use a gradualist approach, just go incrementally till the time that we are able to cover the entire program space. We have moved just to do 40% of what we expect to do within this year, and then we'll grow from there into next year. Just that bit I wanted to add.
Okay, thanks for that, Desmond. Really important point about this being one tool, and the toolkit not always useful in every place and every time, and scaling may not be the worth time and effort or even helpful. Thank you for that. Okay, so any last comments on this or other comments?
I can make a
Yes,
last comment
please.
on this, at
Anisha,
least
come in.
on the on the age-old debate of inclusion versus coverage. But I think it also depends like how we think about the concept of scaling, right? Just to Desmond's point, whether it's a project, whether it's a program, whether it's behavioral science as a field, whether it's certain principles of testing and like experimentation that are the main takeaways, or of involving communities, like what part of it at which level are we trying to achieve scale, and is it through institutional collaborations, is it through program reach, and there can be different ways, and I think that maybe is the next sort of debate to have on how we go about that.
Great, thank you, Anisha. That's a great way to end. That's a great note to end the webinar on. There are lots of ways we can think about reflecting on our conversation, taking this forward. In the last 30 seconds here, I will just nod just a couple of questions about how to stay engaged. There's the Behavioral Science Group, and you can join. The links are in the chat to keep the conversation going. Hopefully we'll have more on this topic in particular. How do we apply behavioral science and scale behavioral science in the Global South? This goes for anyone. I know there's a question about consultants too. If you join the group, you can get engaged and hear about what's happening in the UN, outside the UN as well. And academics, international organizations, civil society, NGOs. It's a space for everyone to collaborate and work together. All right, with that, thank you very much for this insightful discussion. I feel like we just got going and now we're ending for today. But thank you for joining our panelists here. It's lots of insightful things. I encourage you to check out the links that were shared, the work of Ideas 42 of UNICEF, and hopefully we'll have some publications, Kirshen, one day, all the projects you're doing and working on there when you're able to get some of them through. And thank you, and for Cinco too, after we'll share some publications of yours when they come as well. So thank you very much for joining us, and we look forward to seeing you on another webinar soon. Thanks, everyone. Bye for now.